Statewide Small Business Alliance of over 1,500 members who seek inclusive policy solutions for business and the communities in which they exist. MSA has been very active in the healthcare reform efforts, beginning with the Affordable Care Act and in its implementation here in Oregon. Mark co-founded Cascade Management, a 400-employee care community and affordable housing provider. Presently, he and his wife Kathleen are the owners of BrainJoy LLC, a 4-employee healthcare provider specializing in neurofeedback. Mark is active in civic and community efforts, having served on his local city council, numerous advisory boards, and committees. Mark is presently the regional chair of Healthcare for All Oregon, the single-payer movement in Oregon, and we're so glad to have you here this evening. Thank you, Mark.
Well, thank you very much. I see many a friend and new acquaintance and friend-to-be, I'm sure. So I would say a friendly crowd on the whole. But if not, please be yourselves tonight. I'm going to try to do the same. First, I thought I would tell you a little bit about how I got actually involved with the Affordable Care movement and now the single payer movement, or Healthcare for All movement in Oregon. So as a little brief bio said, I'm the co-founder of a company that's grown from myself and a half-time employee, which will be now 25 years old on June 3rd. I have the good news to say I retired after 23 years. That's the good news. It was an employee leverage buyout situation, so I have a lot more time to pursue interests. Cascade Management, though, when we started, we provided coverage benefits, and we provided medical care for our medical insurance, healthcare insurance for our employees, their dependents. It was major medical, included vision and dental. In those days, it was only a $500 annual out-of-pocket expense. I know, hard to imagine. And the total cost was 8.5% of payroll. So we thought very reasonable. So that's 25 years ago. As time went on, this is of course a common story, but it's also a horribly difficult one to tell, and I actually often get emotional when I tell it. But as time went on, we had to drop the employees' dependents from coverage, and then we had to raise the deductibles. So it went from $500 to $2,000 to $2,500, and then it was employees paying a portion of the premium, et cetera, coverage coming down. First to go was dental, of course. So today, 25 years later, the cost for a much less coverage, not including dependents, is 18.5% of payroll. To get comparable coverage to what we used to have would be 32 to 35% of payroll. So from 8.5, let's say even to 32, that's 4 times. It's gone up, quadrupled in 25 years. So that's a crisis. The reason it's a crisis is because the cost has gone up so fast, basically 2.5 times as fast as inflation, that we've had to trim everywhere, including salaries and wages. So really it's not just coming out of our pocket as employers, it's coming out of the pockets of all our employees. So from the employees' perspective, they really consider not health insurance, but really more catastrophic insurance. And that's how it gets used. So 2 years ago in March, I was approached because of my role with Main Street Alliance to speak on behalf of small business at the first time what was then House Bill 3510, the Healthcare All Oregon bill, was introduced in the previous session. And so there were about 30 of us that spoke. There were 9 of us that spoke as part of the initiative. And one of those was, of course, myself. So I prepared and even memorized a speech, but I don't have it memorized anymore. I only want to read 2 paragraphs out of it, though. And they're the 2 paragraphs that got me into a lot of trouble, just to let you know. But they're also the 2 paragraphs that got me committed to this movement and to single payer particularly, and its inevitability in Oregon and in the country. So after a long situation, or after telling our situation with Cascade, pretty much what I just told you, a little bit more detail, I'm into my closing, and here's what I say. I say, being a caring and thinking person, I naturally wonder if it's not time or past time to consider paying for and providing health care differently. Differently, at this point in time, almost certainly means making structural change in how to provide and pay for medical coverage. Most of us are very ready for a system of medical care that is on plane with perhaps even someday ahead of the rest of the modern world. So here's the quote that really got me. The truth is, we are presently a third world country when it comes to providing medical care to our citizens. So that was a quote that, yeah, perhaps worse. So afterwards, I was rushed out and all the cameras were around me, and guess what they wanted me to talk about? And I did, and apparently adequately, and I ended up on 3 TV networks, and thus my whole history and my role in the single payer movement began. The good news is there exists a proven, efficient, cost-effective, and equitable alternative for providing health care to all Oregonians. I believe it's time, if not long past due, and of course this was a hearing, that this be considered. Oregon ought to once again lead the nation and be the first state to institute a single-payer medical system. So we won't be the first state because Vermont has beat us to it. Although they're not way ahead of us, but definitely on their way. It's like 2017, if things continue, they'll actually be able to implement their system. So let me tell you a little bit about our current status beyond just employers under the Affordable Care Act and insurance as it is pretty much today for all of us. So first of all, we're paying twice as much as the rest of the nation, certainly our immediate neighbors where they have universal care. So let's take Canada. It's a really close one and easy to compare ourselves with. In Canada, it's 8% of their GNP goes to healthcare. So who wants to guess what it is in the U.S.?
18. 32. And going up fast.
It's 18. So more than twice the Canadian system. But that's only part of the contrast. In Canada, they provide coverage, medical benefits, health insurance for what percentage of their population?
500.
And in the U.S., what do we provide ours?
60?
65.
Yeah, it's close to 60. So that will go up slightly in 2014 with the Affordable Care Act when Medicaid gets extended to a good percentage, about 15% of the population who are the lower income and can't currently pay premiums. So it's still, though, when the Affordable Care Act is fully implemented, which won't happen in 2014, it really won't happen until like 16 or 17, how many Americans will not still have coverage?
50 million.
25 million. And we haven't really addressed the core issue with our system. So it's still going to be just as expensive. We haven't changed the delivery of service. But what aspect of the current American system is really the challenge and probably the root of the problem?
Insurance companies.
Yeah.
Somebody said insurance companies?
I said insurance companies.
All right, so that's not the only problem, but it is the core problem. It's called the problem of the middleman.
Yeah.
And this middleman holds out in profits and administrative overhead and CEO salaries, some of which are like $30-40 million, It's 400 billion a year in the U.S. In Oregon, it's actually 40 billion. 1% of that is lost, doesn't go to coverage, goes to marketing, all sorts of other crazy things. And that's enough dollars actually to provide all of this coverage, including those 50 million that are currently not covered. And cover them actually better than they might be if they're currently insured. So the insurance company is part of the problem, the biggest part. What's another part of the problem?
Big pharma.
Big pharma.
Big pharma,
And
yeah.
what's the problem there?
Cost. Huge money.
Huge profits.
Huge profits.
Not competitive, but big.
Yeah.
Right.
And we do the research at our universities and they get all the benefits.
Right. So Big Pharma has pretty much owns Congress and has, over the last 30 years, done a wonderful job carving out something that Big Pharma has not been able to do anyplace else in the rest of the world. And crazy, I mean, there's the crime of this is almost undescribable, but in the last Medicare, Medicaid reform, probably you remember, that's when we carved out more coverage for seniors. It was sold as a wonderful thing. It was a really wonderful thing for seniors, but it was infinitely a more wonderful thing for Big Pharma, because that's when they negotiated the requirement that we could not bargain with them. And how much do you think that cost the system, not being able to bargain? It's billions. Yeah, like 35 billion a year. It's a big number. So the VA can negotiate, every other country negotiates, but we cannot negotiate. It costs us 35 billion a year. So that has to be addressed as well. So the short of it is, the problems really have to do with the middleman, with insurance companies themselves, how they do business. They cause a great deal of inefficiency, make it difficult for doctors, hospitals, all sorts of different programs, all sorts of different coverages, obviously deductibles, co-pays, etc. Bottom line, it's really all designed so that insurance companies make profits, and big profits at that. So the Affordable Care Act did not address that whatsoever. So there's a handout there on the Affordable Care Act, and next to it is a comparison to single payer.
I'm just gonna pass it around in case anybody wants this.
Mark, what about for-profit hospital chains? To what extent do they?
Got it. There's a meal on the floor.
Well, as long as their fees are constrained, there's some market force constraint or other constraint, it's a small concern. Interesting enough, in Canada, the provision of services is through for-profit entities, private entities. So physicians and clinics and hospitals are for the most part privately owned. So they've been able to solve that, at least in Canada. So, which brings up an interesting question. It's the difference between socialized medicine and what Canada has, or what is proposed here in Oregon. Does anybody know what socialized medicine is?
Like Britain, where it's owned by where actually
Government.
the providers are government.
Correct.
And no one gets a bill.
Well, in single payer, no one would get a bill too, but the infrastructure, the capital improvements, the hospitals, the medical equipment would be publicly owned.
Everything.
Everything's public.
Everything is.
The veterans administration.
Yeah, veterans.
Centralized medicine.
Correct.
In Cuba.
Yeah. Cuba and VA.
Okay.
Right.
Also Britain, of course. British health system, they own
I think Congress is the
everything.
same.
Well, they have a tremendously wonderful health coverage, health insurance, but they go to private providers to get their medical services. So the good news is most of us have come to this, but I don't know your stories, but probably most of us have come to this late in the game, so people have gone before us and done a tremendous amount of work, going back 50 and 60 years. So if we were to take the time and go through the history of the U.S. and Canada, interesting enough, and see how similar they were, where they diverged from each other, the different paths they took, and also to look at the U.S., the number of initiatives and key leaders that have tried to move the country to a single-payer Medicare for all type system. And there have been lots. There have been some tremendously great leaders, but unfortunately, until the Affordable Care Act, there had been no success, and some would argue that's not very much of a success. So there's a lot of groundwork that's been done. Public consciousness generally is favorable to single payer, and it's certainly true in Oregon. So let me tell you what the polls are saying. So the polls in Oregon, which were last taken 2 years ago, in 2011 when House Bill 3510 was introduced, indicated that 71% of Oregonians were favorable of universal coverage,
Oh, yay.
or single payer, or Medicare for all. Of course,
Right.
the terms kind of throw people, so you have to define them, but that was the survey results. What do you think the results are in the U.S. as a whole?
60? No idea.
So it's actually 68%. It's a pretty high number are favorable. How about,
That's across the board?
Yeah.
yeah, across,
Generally?
yeah, across. It varies from state to state, to certain pockets. Obviously, there are personalities, and sort of like our presidential race, you can sort of predict which areas are going to be more favorable.
Mark, how current is that polling?
That was done by Public Citizen, and was just published in 2013, January.
And how was the question
That's not
asked?
That I'm not sure. How many are familiar with Public Citizen? It's a large, Ralph Nader began 40 years ago, really excellent. They've been on this, one of their core issues has been universal health insurance. So what percentage of doctors do you think favor the change?
40.
80.
Doctors or healthcare workers?
Or nurses, yeah.
These are medical doctors.
Nurses and physicians.
These are medical doctors, not real doctors.
Yeah, medical doctors, correct.
56.
Oh, about 60%.
So it's 59%. So a majority of today's doctors, now this has not always been the case, and it's gone up and down. And again, history has some interesting stories to tell about this. When opposition comes and propaganda arises, that number will drop down into the 30s historically. But currently, 59% of the doctors favor and nurses favor. And why do you suppose doctors and nurses would favor that?
Better patient care.
Better patient care?
Less paperwork.
Less paperwork?
More profitability for them?
Freedom of choice, better care, yeah?
Is there more profitability for the
Oh,
nurses and
probably,
doctors?
yeah.
Right?
Get insurance
Potentially
out of
so,
it,
yeah, because they become more efficient,
More efficient.
lower their cost overall.
And more even in terms of what they get?
Yeah.
The services.
That's true,
They don't have to deal with so many parties, too.
right? So part of the reason single payer is so attractive is the medical, let's say, establishment or system. This 59% actually see tangible benefits in a much more efficient system, which allows them to truly practice medicine and not have to practice, insurance, whatever that might actually be. So yeah, that's a huge savings. So out of the 400 billion that would be saved, or in addition to the 400 billion that would be saved, there's another 150 billion, that's 550. That 150 billion comes from efficiencies within the medical offices, hospitals, etc. So that's a big, big number. So the good news is this, our system, while it doesn't work very well, the middlemen are carving out a huge amount at a great expense to us. The good news is we're paying enough currently to provide coverage for everyone in a system that is much more equitable and fair, and a system in which we can control cost over time. So we don't have to pay anymore. If we were to tax ourselves to do this, the total cost of taxes would not exceed insurance premiums, deductibles, co-pays, and other out-of-pocket. So we have money, actually more than enough money to do it today. That's a good thing. It's still twice as much as what Canada would be paying for the same, but you know, it's sort of a leg up in a strange sort of way.
How do you sell this to conservatives when you mention the word tax? They go apoplectic. How does that go?
So that's an interesting question. So relative to Oregon's healthcare for all Oregons, or Oregon single payer movement, which now has 60 plus organizations as members, the focus is on healthcare as a human right. So they're dealing with the primary aspects of it. Now in certain circles, like business circles, there are discussions beginning, presentations being made, and you know, those sorts of objections will have to be met. But primarily it's being seen, you know, like education is something that everyone deserves equal access. And we all understand the public good is, you know, very large, and to go without would be not good for ourselves and obviously future generations. So the same is true with healthcare. Now, as a businessman, I can tell you some of the arguments, and we know what they are. So first, a healthier workforce is a more productive workforce.
Amen.
The cost savings versus people in and out, you know, care, particularly extreme, you know, life-threatening types of diseases, the cost of that to an employer, key person, let's say, is very great. Another reason is if he's not paying the insurance costs. So in Cascade's story, our insurance was doubling in cost every 7 to 8 years. So it's really hard to manage. You know, it's the fastest growing cost for which we had no control. You know, all the things we did to drop coverage and give employees their share and more, you know, we didn't really solve the problem. So from an employer standpoint, to be able to find a public solution, it takes a big burden off your back. Huge. Those are some of the reasons why.
So yet, I mean, kind of off of that question is, I've dialogued often with conservative-minded people who consider healthcare and a number of other things, education even, ought to be private and ought to be, you know. So there's a mindset that I've interacted with, a conservative mindset that considers healthcare not to be a human right. I think otherwise, but finding a way to make it make altogether sense. And the dollars and cents that you're talking about makes a lot of sense in terms of managing the economy, in terms of a lot of things, finding ways to get inroads into that kind of consciousness, especially with the PR that is so strongly placed out there. They're looking to privatize penal systems, privatize prisons, privatize education, privatize schools, everything. There's huge privatization, and which has to be kind of similar as the big money in pharma and the big money in insurance. That kind of power looking to, you know, solidify. So working against that, to go counter to that is something that's very interesting.
Yeah. So the movement, let me tell you more about that.
Okay.
Because the movement's history in Oregon actually has run up against this at the ballot box and at the TV tube when the big interests spent in 2003 when there was an initiative, single payer initiative, or Initiative 23, which prior to 2.5 months before November 2nd or whatever the poll day was, had a favorable rating of 63% and was predicted to pass, and went down with only getting 32%. $18 million was spent in 2.5 months by the opposition.
But was that honest advertising?
No.
My sense is that the
No.
argument that.
But it worked.
It works, but, so the problem is that folks are buying lies about the quality of care. Same thing with education, lies about the quality of education. So the data that you portray about how this is being going to be better for business, better for healthcare, that doesn't get through.
Yeah, so we don't think, the movement does not think, Healthcare All Oregon specifically does not think that we're going to be able to spend dollar per dollar when we go to the ballot box, which will come. So these will be referred by the legislature, because once we figure out how to pay for it, that mix of taxes and fees or whatever it might be is going to require the voters to approve. That's an Oregon constitutional. And or it'll be a citizens initiative and referendum, so it's still at the ballot box. And more likely today would be spent 30 to 40 million. In Vermont, little Vermont, the opposition spent 23 million. You know, Vermont's like 1.5 million people. Yeah. So the way to combat that, of course, is through grassroots organization, everybody informed, everybody well informed, and a process that doesn't happen in a week or a month or a year, but several years. So the goal right now in anticipation is to win at the ballot box. We need 900,000 plus, 1 million in nice big round numbers of voters to pass something in 2016. So that's 4 years away, 3+ years away, what is it? 2013.
Mark, how does that intervene with the Affordable Care Act, and Oregon is supposed to be ahead of the game in that, and we're receiving some, we're expanding the Oregon Health Plan, et cetera. So how do we make it, how does it?
Right, so there is a wonderful piece that talks about the bill itself. It's a 2-page summary of the current bill, Healthcare All Oregon Act it's called, and it talks about the Affordable Care Act and how we'll leverage that. But the short version, even shorter than what's on there, is we'll take the dollars that are being given to us from the federal government, which is expanded Medicaid, it's a large expansion. So 25 million people that come into the system come through expansion in Medicaid. So we take those dollars, it takes, of course, waivers, you've heard that term, federal waivers. Vermont still has to get its waivers. So use that money. You actually could use VA money, may or may not happen. You could use Medicare money, which probably will happen. So you want everybody in as large a pool as possible, single program, single administration, all the economies you can possibly get. And you want them in a wellness, health program, not a disease treatment program, which is what we currently have. And it will take some new dollars. Employers will be kicking in for sure. And what Oregon wants to see happen, what's in the bill, is a progressive taxation. So if you have little or no income, you're probably going to pay little or no for your health care. If you're, a billionaire or whatever, you're going to be paying, obviously, for somebody else's care as well. Hopefully, yes.
No. Where does Senator Bates stand?
That's a good question. We met with him. I think we had a very good meeting with him. How many were there by chance? So quite a few. So what are your thoughts about Senator Bates?